Hello everyone. Our today's discussion will be on high blood pressure, that is hypertension, and how to prevent it. Good evening, this is Dr. Abir from NH Tagore International Institute of Cardiac Science. Generally, everyone would like to have healthy or normal blood pressure, but what is blood pressure and what does that mean? Basically, each time when the heart beats, it pumps blood into its vessels, in the blood vessels, and it creates a pressure on the walls of the blood vessels, and that is called blood pressure. Normally, in healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer period of time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices. For example, not having regular physical activity at least 30 minutes a day for at least 5 days in a week, physical activity, obesity, smoking with nicotine, be it cigarette, tobacco in any form, stress, etc. There are other risk factors that also can increase the risk of developing hypertension, and they are age. As the people gets older, the arteries stiffen up and narrow as excess fat builds up. Family history of high blood pressure. One or more close family members with hypertension can lead to high risk of developing this condition. Excess salt intake, be it fried salt or raw salt, causes raised blood pressure. Not eating enough foods with potassium rich such as banana can increase blood pressure, and then it can lead to stroke and chronic kidney diseases. Eating processed and fatty foods increase fats throughout the body and make heart work harder to push throughout the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further rise of high blood pressure. Another one is stress. Reacting to stress in unhealthy ways and not managing stress can increase high blood pressure. Moving on, hypertension does not have any obvious signs or symptoms. That is why it is often called the silent killer. It puts people at risk for several diseases, from cardiovascular problems to kidney failure, stroke, and even eye damage and blindness. Hence, early and accurate diagnosis is very important in management of hypertension. Managing blood pressure is the only way to know whether the person have the high blood pressure or not. Generally, when symptoms do occur, they include morning headaches or tiredness, vision changes such as blurring of vision, buzzing in the ears, fatigue, nausea, vomiting, reeling of head. All these symptoms occur. If person is experiencing some of these symptoms, then one should get their blood pressure checked immediately. It is usually measured with an instrument called sphygmomanometer. A blood pressure is recorded in two numbers. One is systolic and another is diastolic. The upper one is systolic blood pressure, lower one is diastolic blood pressure. Now let's try and understand what these numbers mean. A healthy or normal blood pressure should be lower than 120 by 80 millimeter of mercury, or it can also read as 120 over 80 millimeter of mercury. Here, the upper number indicates systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates diastolic blood pressure, means the pressure in the blood vessels when the heart rests between the beats. If blood pressure level is or more than 140/90, the person is hypertensive and he is having the disease called hypertension. If person have BP levels higher than these, then he or she might be at risk of developing serious heart problems. This risk can be prevented and reduced by taking the mentioned steps and following a healthier lifestyle. These are regular exercise, 30 minutes of brisk walking daily for at least 5 days in a week, healthy diet, which is less consumption of salt and more consumption of fruits and vegetables, quitting smoking of and leaving tobacco of any form, and reducing alcohol intake, regular blood pressure checkup, stress management, and adherence to medicine if it is prescribed by the doctor. If blood pressure is successfully controlled with such lifestyle modification, then it might avoid, delay, or reduce the need of medication. So let's take a look of these strategies one by one. First is regular exercise or activity. Exercise can be drug-free and approach to lowering high blood pressure. Regular physical activity makes person's heart stronger. If one have strong and healthy heart, it can pump more blood with less effort. So if heart has to work less to pump, the force of the blood vessel will decrease and lowers the blood pressure. In other case, as we all are aware that age and weight gain, these are the two major factors for high blood pressure. So if the blood pressure is at a desirable level, means less than 120/80, then exercise can help preventing the high blood pressure. Regular exercise also helps you maintain a healthy weight, which in my opinion is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic activity most days of the week. High blood pressure level can be reduced by doing regular structured exercises such as brisk walking, as I mentioned, jogging or swimming or cycling. Number 2 is healthy diet. Diet also plays an important role in controlling blood pressure. A diet with a high intake of vegetables, fruits, whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension, through dietary intervention, one can adopt a dietitian pattern such as DASH diet or Mediterranean diet, eating less saturated fat or total fat, getting plenty of potassium, which is plenty available in banana, limiting the amount of sodium in the diet. DASH stands for dietary approaches to stop hypertension diet. Eating a DASH diet, which is rich in whole grains, fruit, vegetables and low-fat dairy products, and skips on saturated fat and cholesterol, can lower one's blood pressure by up to 11 mm of mercury if having high blood pressure. Reduce sodium in your diet. Even a small reduction in the sodium in the diet can improve the heart condition and reduce blood pressure by about 5 to 6 mm of mercury. To decrease sodium in your diet, you can consider tips like read food labels if possible, low sodium alternatives of the foods and beverages you normally buy, eat fewer processed food, only a small amount of sodium occurs naturally in foods, most sodium is added during processing, so you can eat natural products, don't add salt in your diet. Just one level of teaspoon has 2300 mg of sodium. Avoid adding salt to food. Use herbs or spices to add flavors for your food. Quit smoking. Stopping smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart diseases and improve your overall health. Another one is regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up for their blood pressure. Hence, most often it is advisable to take a self-monitoring of BP machines at home. Self-monitoring helps person to measure BP at different times throughout the day and over a long period of time. It also assists doctors to get a more complete picture of person's blood pressure readings at different times. Further steps helps us in better prediction of cardiovascular morbidity and mortality rather than single routine blood pressure measures that occur during a clinical visit. Stress management. By learning how to relax and manage stress can improve emotional and physical health and lowers high blood pressure. Stress management techniques include exercising, listening to music, focusing on something calm or peaceful and meditating. Doing yoga and meditation can keep your body relaxed. Adherence to medicine. A medicine to lower blood pressure may be recommended by doctor if your blood pressure is constantly high, usually above 140 by 90. Adherence to medicine is very important as it controls your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adopting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways as I discussed earlier. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventing care. Thank you.